Among the many challenges and changes brought by the pandemic, perhaps one of the hardest has been the inability to visit loved ones in hospital, especially those receiving intensive care treatment. It led to one New South Wales regional hospital coming up with a custom-made solution using an innovative video platform that bridges the distance for families and friends wanting to stay connected while staying away. To tell us how the idea came about and what it means for patients is intensive care trainee Dr. Kathleen Thomas from Wollongong Hospital. Welcome to Regional News. We've caught you on what is sure to be a very busy day, Dr. Thomas, but just take us back to what was involved in getting this idea up and running and creating this incredibly wonderful way of keeping patients and families and loved ones connected.
Sure. So when the COVID pandemic initially hit, it was really very obvious that from seeing our families and our patients suffer by not having their loved one with them at the bedside, we immediately started trying to figure out a way to simulate the patient-family interactions. It was surprisingly challenging. I think we thought this would be a fairly simple, straightforward thing to implement into the unit, but it was actually quite difficult. So we tried several different sort of off-the-shelf video conferencing platforms, but found that they just didn't work as they're normally designed for two able-bodied people. So to fit into the unique environment of the intensive care unit, where you often have a nurse or a doctor actually using a device on behalf of the patient, we had to collaborate and be innovative. So we generously received the help of a technology adoption specialist organization called Taleka, and they were able to figure out how to bring in different companies to work together to create our platform, which is now called How Are You?
No, do go on.
Oh, sorry. So I think what's quite amazing and unique about this platform is that we are able to simulate what we feel is the most is a really accurate representation of our normal, flexible and open visiting. So we use the Cisco Webex Teams app, but that in isolation is not enough. So what we've then done is brought in a company called Citrus Health has developed an automation component so that our ICU staff can very, very quickly bring a patient in, create a safe and secure space for all family members to then constantly visit as often as they feel they would like to, in knowing that their space is secure and open whenever they need. This also allows our nurses to be able to open up the space for the family and then to leave the video open for the patient and the family to interact as much as they want. So this is particularly important, towards the end of life, or when a patient's critically ill and they may want to have some special last words or some special words with their loved one. So having that flexibility to open the space, leave it open, and then allowing families and patients to interact is really, really special.
Is it possible that this program may continue on and, given the difference that obviously it's been making to patients and families?
Yeah, we certainly hope so. So at the moment, we have set it up for at least another year. And while it was initially planned for the COVID patients, we are actually using this for all of our patients now. So because there are still ongoing restrictions for visitation in terms of into the hospital generally, but also the fact that borders are closed and travel is very, very difficult, we've been able to offer this to all of our patients, and we've had amazing international visitors from all over the world that have been calling in. So yes, we plan to continue to have this as an option for at least next year.
It just adds to all the wonderful work that you're doing. Dr. Kathleen Thomas with Wollongong Hospital, thank you so much for taking the time to speak to us on Regional News.
No worries, thank you for having us.